on this computer.
I'm Michael Dixon, and I'm a GP by day and also chair of the College of Medicine. And it's a real pleasure to be asked to speak at this summit on Ayurvedic medicine. And many congratulations to Amarjit on having got this summit going, because I'm a real fan of Ayurvedic medicine. And it's not just because it works, and not just because there's a developing evidence basis for it. There's several other reasons. One is a very personal one. That's to say that I've been helped myself, both physically and mentally, by Ayurvedic approaches, restoring health both spiritually, mentally, and physically from Ayurvedic medicine. The other aspect, which I think is so important, is it has such a long tradition. And of course, Ayurvedic medicine precedes even Hippocratic medicine, and so we shouldn't really throw away these ancient wisdom because surely the past can tell us something about how we should practice medicine today. And we're too ready to just throw out the baby with the bathwater and say conventional medicine is the only answer. Whereas what we should be doing is combining the wisdom of the past with the science and wisdom of the present. The other thing I particularly like about Ayurvedic medicine is it is very personal. We live in an impersonal age where you often don't see the same doctor or nurse, and where too often people feel that they are numbers, they're cattle being run through a system on whom we practice our evidence-based medicine. Now, of course, Ayurveda is quite different. It's very personal. You've got the three personality types to begin with, the Kapha, the Pitta, and the Vata. And each treatment is peculiar to the needs, aspirations, existence of that individual person. And feeling that you're being treated as an individual person is particularly important. And in a day when we're so unconnected, where we don't have those relationships, where some of us just don't feel treated as individuals. The other thing I particularly like about Ayurvedic medicine is it has this very nice mix of people being personally activated in their own treatment as well as receiving treatment in a more conventional way. And I'm thinking particularly here of yoga, for instance, where it requires a certain amount of energy and resolve to do yoga. And that, plus the, if you like, the social aspect of it, all mixes in to provide a treatment that's not only pleasurable, but one that the patient, the person has to take an active involvement in. And all these things, whether it's your health, whether it's your trying to reduce smoking, drinking, increase exercise, socialization, whatever, you've got to be an active part of your treatment. In fact, in social prescribing, we measure this by looking at something called the activation index, the degree to which you are in charge of your own health and destiny. And I think Ayurvedic medicine, particularly yoga, is so good at doing precisely that, at energizing us to look after our own health. Well, I think I've given you enough reasons to say why, not only am I a fan of Ayurvedic medicine, but why it's so important that this summit is taking place today. I'm only sorry I can't be with you. I'm many thousands of miles away, quite sadly, but I shall be very interested to hear about what does happen at this summit and seeing a future for Ayurveda, which is so important, I think, for so many people.